Thank you, and welcome to the committee. I appreciated our discussion some days ago and the opportunity to drill down just a little bit further. I mean, you come to this nomination with the background and the experience that you've had over in the other body. You are one who comes from a pretty urban area. We've had an opportunity to speak about some of the specifics that are Alaska specific, but more broadly to rural itself. And as a member of this committee, as health matters are brought to bear, I always will ask a question, many questions about rural health care, along with Senator Collins here, and so I'll start with that generally. You represented a population-dense urban congressional district, so as HHS Secretary, how will you champion policies to provide what we both acknowledge is sorely needed with regards to health care in both urban and rural parts of the country? And specifically, how do you make sure that we have adequate representation when it comes to the priorities of HHS, when it comes to accessing rural health care? Because our challenge is access to the care. And when you don't have access to the care, it's costly and just very generally challenging.
Senator, first, thank you for that opportunity to chat with you previously, and I enjoyed your laser focus on these issues, and I think it's appropriate. The challenges that the folks in your state face are unique to rural communities. Other states face it, but I think, as you explained so well, even for Alaska, sometimes it's unique even among rural communities. And I will tell you that what we must do is make sure that we are prepared to meet those unique needs, whether it's the workforce, oftentimes we forget about that, the transportation obstacles that folks in the state of Alaska will face, dealing with broadband, just making sure there's access. Telehealth, I know, has become very important. We discussed that as well. Let me tell you that the most important thing I can do is try to assure you that as much as the needs in rural America are unique, I always would tell folks when I was a member of the House that while I represented one of the most densely populated areas of the country, we had some of the greatest disparities. We didn't have to travel 1,500 miles to find the disparities. We could just travel 15 miles from East Los Angeles to Beverly Hills to see the disparities that existed. But again, rural communities do face a different challenge. 15 miles is very different from having to travel 1,500 miles in one state. And so I will say to you that what I should do more than anything is, if I'm fortunate to be confirmed, is take you up on that invitation to go to Alaska to see firsthand the challenges that the people in Alaska face.
Well, I would encourage that, and I would encourage that visit early. One of the areas where we have, I think, been innovative with regards to distribution of the COVID-19 vaccines that are out there is how through the IHS we've really been utilizing the experience of a distribution system that has been set up and just, again, an ability to just make things happen, not because we're following somebody else's guidelines, but because we know the need is there. So you're going to be making some pretty key decisions with regards to funding allocations for provider relief, for testing, for vaccine distribution. And what I've been hearing from folks back home is when we get the vaccine, we are really good at pushing it out. In fact, we're number one in the country right now in terms of percentage of Alaskans that have been vaccinated. But I would ask for your support to make sure that when these funding allocation decisions are made, that funding for rural areas is going to be prioritized as well.
Senator, I know that you and Senator Manchin are working on legislation to do just that. And as I said to you in our conversation, I commit to you, I'll be at that table talking with you and those who understand these unique needs of rural America. The last thing I need is to be one who doesn't address these disparities in an aggressive manner. As I said, I'm fortunate that my mother is now 87 years of age. Most people in my neighborhood at that time did not have health insurance. They probably would not have survived such a difficult time seeing your mom whisked away to the hospital. So absolutely, I'm committed to working with you to make sure that we do, whether it's through resources or through the workforce, providing the type of services that are needed in rural America.
One thing about COVID-19 is we have really shown a spotlight on where these health disparities are.
Yes.
And focusing on those in rural areas, I think, is key. Thank you, Madam Chairman.